blocker yet. I thought it was because students were laying on the table, but nobody's laying on it. Still at school. Okay, let me have you two guys go. I'm going to hit my head. But my ear tie is popping off. Being retarded. There we go. Okay, so let's go ahead and shield her. Okay, so I'm going to have her bring her left arm up by her side, raise up, let's get your hair out of the way. You can give her the pillow, but have the pillow just in the corner. Go ahead, straight it down. Because you don't want it over the neck area, okay? So I'm going to sit her. So the top of the cassette is where? BEA. Close. Bottom of the ear attachment. So look at the position of the blocker. Remember that the esophagus is going to curve around here and then go this way where it enters the fundus. So which do you think would be better, blocker up or blocker down? You know, you guys can come to this side so you can see. I feel like I have a bunch of people behind me. Blocker up. Because we don't want it in the fundus. Right? So blocker up for the RAO. Morning, I turned around, I'm like, wow, there's so many more people. Yeah, it's too loud. Okay, so the top of the cassette's going to go at the bottom over here. Just be careful leaning on the table. Alright, can you take your hoodie off for a second? Or is it too cold? No, I can't. It's kind of right in our anatomy.
I'll change.
From
Did
you go home? Oh.
No, I just went to my car and grabbed my gym stuff. I was going to wear my gym stuff here, and then you told us the pictures, and I was like, oh, gym clothes. But then I hid myself in.
I know, you ran away, so you had a gown on. Okay, that's better. Okay, so I'm going to have the bottom of the ear at the top of the cassette here, or, which will be at the same level as the chin. The CR side to side, here's her spine, so I'm going to go just lateral to the spine. So you can imagine the esophagus is going to go here, it's going to curve around here, and then it's going to enter the stomach here. Now remember I told you to palpate for the bottom of the inferior border of the scapula, and that's where the junction of the esophagus and the stomach should be. So if you've got the inferior border here, you've got the line at the bottom of the ear here. See it? And then side to side, you've got it just on the upside or just to the lateral of the spine here.
So under the earlobe?
Yes. Okay. So now I'm going to give her the cup with a barium. So she's going to hold the cup here. Most of the time we have the straws that flex, so you're going to have her hold the straw in her mouth. Hold it with your thumb there. Mm-hmm. Okay. And then she's all set up. Oh, I need to put my marker. Oh, I left my marker in the classroom. Okay, because this is the left side of the body, I'm going to go ahead and put my marker here. It is an RAO, so you could put the right marker on this side, but because the esophagus is going this way, I think it's a safer place to put it here.
So left side on the upside.
Yeah, and it's facing down because she's facing down. So it looks correct when you look at the image, right?
So side up. Is that still apply? Side up, side down?
Well, no, that's a different side up side. It's face down, face up. If she's facing down, the marker faces down. If she's facing up, the marker faces.
But you're saying you have the left marker, right? On the
correct, yeah.
On the side that's up.
Well, I have the left marker on her left side.
Oh, okay. Okay.
Just so it doesn't really matter which side is down or up. I know what you're saying with the oblique. I know.
Okay.
It would be just as correct to put the right here. I just don't want to put it
so we
in
can use either or.
Yeah.
Okay.
Okay, so this is all set up. So I'm going to step back and say, okay, I'm going to have you start drinking. Drink, 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 drink. Stop breathing.
Okay.
Expose. So she has to take about 3 to 4 drinks. So the first time you say drink, they may probably not drink. Mm-hmm. So you're waiting until they really get a full column of barium before you make the exposure. Okay, very good. Now we're going to go ahead and do one more picture. So I change out my cassette. All right, I'm going to have you lay up on your right side facing me. And have you noticed, if you haven't yet, patients sometimes have trouble telling their left from their right, so that's why I said right side facing me, so that gives her kind of a cue as to which side she's supposed to be facing. Okay, so go ahead and bring both arms up by your face. All right, so now I want to make sure she's in a true lateral position, so it's just like doing the T-spine. For some of you, it's going to be harder to see this because your perspective's lower. So you may actually have to come up to the head of the patient here and make sure she's lateral. Now notice she's sort of at an oblique, which often happens when people lay on their side. So I'm just going to correct it by bringing her hips forward a little bit. Okay, I think that's much easier than having them scooting back and forth. Okay, so the central ray now is going to go where?
Inferior border of the scapula, so T.
Well,
T14.
the front to back. Remember, if we're at the mid-coronal plane, what are we centered? Oh, posterior. Right. So we're going to be slightly at the mid-coronal plane so that we have the esophagus is going to be just anterior to the spine. When we center for the T-spine, remember we were back here for the T-spine, 2 inches posterior to the MCP. Okay, so now we're like 1 inch posterior to the MCP. You see it? Okay, so now relax your arm down for a second. Turn your head towards me. So see how the light ends up right at her jaw? I don't quite go to the bottom of the ear for the lateral because see where the inferior border of the scapula is here. I want to make sure I include the junction to the stomach. I'll shut her just a little bit. Okay, there we go. So it's hard to tell if you don't move their arm down. Okay, so go ahead and put your arm back up now. Okay, do you see it? Again, I'm going to have her hold the cup with her hand, straw in her mouth, and drink, 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 drink. Stop breathing. Expose. Okay? So now we're done with the esophagram. So, Gina, watch out. I'm going to go this way. More people. I'm going to watch out for more people now, too. Okay, so go ahead and sit up for me. Excuse me. Okay, so she's done the esophagram. She's just drank another full cup, but since she's having a small bowel as well, yeah, I'm going to give you another cup of barium to drink. Go ahead and chug it down. Yummy. And now maybe I'll give her a cup of 7-Up too. Okay, so now we're going to go ahead and go on with the upper GI. So I'm going to, what's the first position I'm going to do? No, we've already done the scouts. You already know how to do scouts. I'm not showing you that. She's already had the barium. PA. Yeah. So go ahead and lay prone. You don't need me to show you a scout, right? You all know that one.
This is upper GI, right?
So this is upper GI. 14 by 17. I'm going to open it all the way. Okay, so now I'm going to feel for the medial border of her scapula. I want the light to be approximately 1 inch above the medial border, which causes the lower border of the film to be 2 inches below the iliac crest. Yeah, so it essentially ends up at the armpit. Yeah, just like we did the upright abdomen before. And then what side is the stomach on it?
On the left.
So I want to either center right at the MSP, or if the patient's a little bit large, like you've got a lot of soft tissue extended beyond your light, then you want to slightly off-center towards the left. Because remember, the stomach's going to be going around this way. We decided next week we're having them wear white T-shirts, and I'm going to draw organs all over, so you can see where they are. Yeah. Okay, so you have the fundus here, the body here, and then the pylorus is going to twist around here, and then you're going to start seeing small bowel here. Okay? So this is just the straight PA. 14 by 17. So here's the inferior border, so I know I've got the fundus of the stomach here, and then it ends up usually for most people. How tall are you, about 5'5"? 5'5". Okay, so, you know, for someone taller, this might be right at the iliac crest. For someone smaller, it might be, you know, beyond the iliac crest. But what you don't want to do is something like this. If you see shield and light, that means what? Problem. Get the shield down. It's fine, you can shield, but just don't shield over the area that the light's supposed to be showing. Because we do have small intestine going this way.
So for the PA, it's going to be at the MSP.
Yeah, unless she's large. I mean, I would offset slightly towards the left so I can include the stomach. Because remember, if she's large and hyperstenic, actually I'm going to show you hyperstenic when we're done. We're going to have a hyperstenic patient come visit us. And I'll show you the difference. Okay?
And the top of the light armpit and the bottom of the light,
Yeah.
I missed that.
Right below the iliac crest.
Okay.
But, you know, it depends on, like I said, the height of the person. Okay, so I've done the PA. one of my cassettes. So the next thing I do, I'm going to have her just go ahead and bring her arm up to the side here, bend her leg. And by doing this, it's going to roll her into a 45-degree oblique. Now be careful with the hip. Don't bend the knee too much, because if you bend it too much, see what happens? And that's where some of you are having problems trying to see how much of a rotation it is. You're putting the hips almost lateral. So you want the knee just slightly bent like that, okay? And then the elbow slightly bent. So this is actually easier to do in oblique prone than it is AP. Because AP you're struggling with the sponge. Okay, now my cassette's going to be what size?
10 by 12 or 11 by 14.
I'm going to show you 11 by 14 first, but actually for her, from her size, I would use a 10 by 12. So, because I'll show you. Here's the inferior border of her scapula, so I have the light right at that point, and then I have the light at her iliac crest, it's just below her iliac crest. And then the back light needs to be right behind the spine, so here's her spine, and the front light needs to be just skimming the anterior surface of the stomach here. Now, when you're working with your partner, if you've got a female patient, be careful when you start touching down here. Okay, because breasts and things can be down there too, especially on patients because they're wearing gowns and they don't have their bras on. So you should always push like down by the waist area with the back of your hand. Don't go grabbing with the front of your hand, because the patient may not know what you're intending to do here.
So
Okay.
is this going to be, the light going to be completely open side to side at the 10?
Well, this is at the 11 by 14, but I'll show you 10 by 12 as
I'm
well.
sorry. Okay.
So for her, because of her size, because she's small, I could use a 10 by 12 as well.
Okay.
So I'm going to change my centering. I still want to make sure my light, see right here is her inferior border. So I still have the light right at the inferior border. The light's still at the iliac crest. So when I had it open to 14, I had it beyond what I really needed. That's why I knew for her I could get by with 10 by 12.
Okay.
Okay, again, the light has to be right at the spine and right skimming the side of the abdomen.
So that's like 2 inches above the crest, you said?
Well, for her crest is right here, so that's like 1 inch now. See that?
No, the center.
This one?
The crosshair.
This here? Which one?
It should be around L2, right?
The crosshair.
This should be at L1, yeah.
L1, L1.
Kind of like your elbow, though.
Yeah, well, it's actually right above the elbow.
Yeah.
Relax your arm here. See, when you've done the elbow, it's like a couple inches above the elbow. The elbow is an indicator of where the gallbladder is. We used to use that for gallbladder. Okay. So do you see this? So this is the RAO. Now, if she was hypersthenic, which I'll show you later, we need to include the abdomen here. That's why we go crosswise. Okay, because you need to include the stomach. It's going to be in the skin here. When you have someone who's got a protruding abdomen, it's likely their stomach's going to be out there too. Usually, large people have large stomachs. They don't necessarily have little tiny stomachs. Okay, so for her, she's going to fit like this. All right, now I'm going to go right into the right lateral. So I'm going to have her turn up onto her right side. Oh, I didn't put a marker on you. Let me go back for just a second. Sorry. Well, close enough. Okay, so this is still her left side, so I'm going to put my left marker down here, right in the light. Okay, just in the very corner of the film. Okay, move up out of the way. See how it's just getting the corner of the light here? Which is what you have to do with your DR systems, because you don't have cassettes, right? Okay, everybody with me?
Yep.
Okay, now go ahead and go right louder. Now scoot towards me a little bit. All right. Another big one. That one never stays very good.
It's a small bowel.
No, upper GI.
So I've done the PA, I've done the RAO, now I have the right lateral. Now again, this happens a lot where they end up diagonal again when they turn lateral. So I want to make sure the back is parallel to the image receptor and that she's actually lateral. So you can either reach back this way and feel that the shoulders and the hips are perpendicular to the table, or if you're shorter and can't see over, just go this way. Make sure that she's perfectly lateral. Okay? So I'm going to show you on a 10 by 12 here. So the light needs to be at the iliac crest, which here's the inferior border of her scapula right here.
That's the
issue. Okay, and then the back light should be just behind the MCP. So here's her MCP, because remember the stomach's going to come like this and then it's going to curve back. And then the front of the light's going to be skimming her abdomen. Now for her, I could even collimate in a little bit, but some people are going to have abdomen that comes out to here more.
So it's like an inch anterior to the MCP?
For her particular body position, but if you have someone who's got a larger stomach, you may have to go anterior a little more. But the point is, you want to have light. Where'd my pen go? If this is her MCP right here, you want to have light just behind the MCP, so it's including the spine. See, but for her, I can send her back a little bit more because I'm still skimming the front of her stomach. I've got a lot of light here. And what marker am I going to put down here?
Right.
Right is right.
So if they have if somebody has a large, stomach that protrudes, you want to go out with the stomach because that's where the stomach is actually going to fall.
Right.
Towards
So when I do the hyperstenic, I'm going to show you, I'm going to go crosswise,
Uh-huh.
and I may have to actually move so that we have the stomach all the way out
So
here.
it's probably really off the MCP,
Yeah,
right?
but you
Okay.
still have to keep the light,
The light
here, the back
with it.
light at the MCP.
To get the
Yeah.
vertebrae.
That's why we have to go crosswise, because we have to give ourselves more distance
makes-
this
okay.
way.
I was
Because they're
trying
hyperstenic, they're more transverse.
Okay.
Okay, so that's it for the normal positions. Now go ahead and lay on your back. Now for some hospitals, they'll do an AP and an LPO as part of their regular routine, or sometimes just if the patient can't lay on their stomach. So if we're just doing a regular AP. APs and PAs are going to do 14 by 17. The rest of them we'll do on smaller film, if that's anything.
On that lateral, is the right marker going to go upside down?
It doesn't really matter.
It doesn't matter.
Yeah.
Is it going to get flipped? No?
I'm not sure, because some people look at it the way you take it and some people flip it. So I
Okay.
guess you got to find out how they look at laterals at your hospital.
Okay.
Okay, so now that I'm doing the AP, here's her xiphoid process. So I want to be at least 2 inches above the xiphoid process to include the fundus, which puts, again, the cassette at the armpits, right?
And the ilium.
So we're about 3 inches above the iliac crest on her. Now, if I'm doing the LPO, I need the body sponge, the triangle sponge. Thank you. I'm going to have her roll towards her left side. Go ahead and relax back. Okay, bring your arm down. Now I'm going back to a 11 by 14 or a 10 by 12. For her, I'm going to use a 10 by 12. So, if I'm going to use a 10 by 12, I have to off-center to the left side, because remember the stomach's on the left side. I'm still keeping the light just above the xiphoid process here. And then I want to make sure that this light's skimming the side of her abdomen. You know, if I don't like my underbelly, I get my patients with my under. So see how here's her MSP, you're centering just laterally to the MSP. But you need to include the stomach that's going to go like this, and then it's going to curve around here with the duodenum. So you don't want to do this, where you have light. Oops. You have light way over here. See how you're off-center that way? See what happens when you do that? You've got too much light over here, and you're missing the stomach portion here. This would be a repeat. You want to be in a position where you take the light and just skim the side of the abdomen right here.
So would you collimate again?
Not any more than not smaller than a 10 by 12. So some guys you're going to have to use 11 by 14 because they're going to be wider and a little bit taller. Okay, that would be acceptable, but for most of the girls that are small enough, you could get by with a 10 by 12. Okay? All right, and that's it for the GI tract. Small bowel. We're simply going to just do KUBs, which you already know how to do those. So the first one is 15-minute and the 0-minute are where?
2 inches above. Yeah.
2 inches above the iliac crest. MSP. And then 30 minutes.
After that.
Oh, yeah.
Crest.
Oh, yeah,
Oh,
crest.
that's going to turn front. Okay.
Wrong.
I don't think I showed small bowel this morning, did I?
Yeah.
Oh, we did? We got interrupted with some. Oh, yeah, I do now remember because of the small of the back. Okay. So here's the small of the back here. So that's right at the iliac crest. If you run your hand along here, you can find the iliac crest. So if you're going to center 2 inches above, you're going to go above this curve right here in the back. So here's your iliac crest, and I'm 2 inches above it. See that? Also, put your arm down for a second. Armpits.
Yep.
Okay. So 0 minute, 15 minute, 30 minute, 45 minute, 1 hour.
Okay. At the iliac crest.
Well, 1 hour is slightly below the iliac crest. Because remember, the barium is going to be down lower in the pelvis now. Okay, so most of you have probably been doing scalp films already as part of your getting your KUB checkoffs, but you weren't supposed to be doing contrast studies because we hadn't covered contrast. Now you can do the contrast studies, the KUBs with the small bowel studies and things, and start practicing them at the hospital. Okay. All right, now we've got a hyperstatic patient coming. Let me make room for this person.
Oh, man.
Went from hypo to hyper.
Okay, so
What's your
That's a really, really good understanding.
Okay, so now we're going to do the AP because he can't lay PA, but what am I going to do with my cassette?
Crosswise.
That's
I'm
why.
gonna go crosswise instead of lengthwise. So I still want to be 2 inches above the xiphoid process. And then if he's really wide, I need to off-center. Which side do I off-center to?
Left.
Because I want to make sure that we get the stomach here. Okay? So the idea is that, you've got soft tissue all the way to the edge, so you've got to include your light over there.
Is there a case where you have to do quadrants?
Occasionally, yeah, I've had to do quadrants on people. Not maybe for GI, but for an abdomen, so I got the entire, diaphragm to pubic and then side to side.
Oh, but not for the GI.
Yeah. BEs, yes.
Oh, really?
I'll show you a couple BEs next week that are they've got this problem with their colon that's expanded.
You said you wanted light right here?
Yeah, so see how the light's barely skimming right there?
Oh,
See, I'm just barely pressing
you
in.
have to push it a little bit.
Yeah, but that's going to be, there's some fat there, so you're just gently pushing though, you're not like. So you have 1 or 2 pillows in?
I got some.
Oh.
Just a little.
Okay, so this would be my AP and then my LPO. Turn. Okay, there we go. So again, you have to pay attention. Now the LPO, I'm going to go lengthwise again, 11 by 14. But again, if this is the xiphoid process here, I want the light 2 inches above the xiphoid, and now I got to make sure that I've got light on the side here, and then light right past the mid-sagittal plane. So, because lengthwise I can't fit it, I'm going to go crosswise here. And frankly, with these really big patients, you end up just shooting everybody probably 14 by 17 because you can on digital. But the idea is to make sure that you see a little bit of light right here so that you've got the outer portion of the stomach.
16 by 16.
Okay? Where it really comes into play with hyperstance, going to make a huge difference in filming is the BEs next week. Because you may actually have to do quadrants. Now, the most I'll show you is upper and lower crosswise. So that, when you have patients, especially male patients, you'll almost always have to do 2 films crosswise instead of 1 lengthwise.
Just tell me.
Now, let's have you go ahead. Did I do a PA? I did a PA with you too, didn't I?
Yeah.
Okay. So let's go ahead and have you go prone now. I know it may be difficult, but take your time.
There we go.
Welcome to being pregnant. Okay, so again, because his stomach, see all this girth that he has here? If I have to do a prone film, I'm going to keep my film crosswise. I'm still looking for the inferior border of the scapula. I want my light right above that. And then which side do I offset to?
The left.
Is that correct?
No.
Here's left.
His left.
Yes. So I want to make sure. See how I've got just a little bit of light here? You can push in slightly on these patients. You don't want to But his girth is a little bit wider than I can do. But here's this MSP, so we know we've got the stomach that's going transverse across like this.
What does your marker go?
I would still use my left marker. I would just put it down here in the corner. Okay. All right. So you don't really have anybody in this group that you have to deal with hypersthenic. So you should be able to fit everybody on a 10 by 12 or 11 by 14. Okay. All right. So you're going to have that's about right. Actually, you have a little bit more time.
Oh, really?
Yeah.
Well,
We
the
have
guy
exactly
came in
an
and
hour.
took pictures.
Yeah, we had a guy that came in to take pictures for a vocational program thing this morning. You guys are much more colorful. Should come back this afternoon. Everybody was wearing black this morning. I was like, geez, what is her morning company? Well, thank you.